Hi guys, today we're going to be talking about the drug modafinil. What is modafinil? Modafinil is a non-amphetamine psychostimulant that is used to promote wakefulness and cognitive abilities in individuals who struggle with excessive sleeping and other cognitive issues. It was first marketed in France in the 1990s and is currently approved by the FDA as a Schedule IV agent to treat excessive sleepiness and other cognitive difficulties. Modafinil's common brand name is Provigil and is usually distributed through 100 mg or 200 mg doses. It is a white to off-white crystallized powder and is a racemic compound. The precise mechanism by which modafinil promotes wakefulness is not well known. However, some of its effects on neurotransmitter systems and other neural systems have been discovered. The behavioral effects of modafinil. The effects of modafinil includes wakefulness-promoting properties for disorders such as narcolepsy and shift work disorder. It has been shown to improve cognitive functions in humans such as neuroimaging, memory, better decision-making performance, and sustained attention. In mice, it has been shown to enhance spontaneous activity, specific exploration, locomotor activity, histamine release, and anxiolytic effects. It also increases alertness, performance, and working memory in healthy, stressed, and sleep-deprived mice. It exerts antidepressant effects through the dopaminergic system through activating dopamine D2 receptors. It also presents a low addictive potential. Adverse side effects. Possible adverse side effects for 10% of users include headaches, nausea, and decreased appetite. 5 to 10% of users may experience anxiety, insomnia, dizziness, diarrhea, and rhinitis. Serious adverse effects include Stevens-Johnson syndrome, a disorder of the skin and mucous membranes, toxic epidermal necrosis, a life-threatening skin disorder characterized by blistering and peeling of the skin, and drug rash. Usage and treatment. Modafinil is primarily used to treat people with excessive sleeping disorders such as narcolepsy, but is also used to treat shift work disorder and obstructive sleep apnea. It may be used to treat ADHD, acute unipolar and bipolar depressive episodes, cocaine dependence, cancer-related fatigue, and multiple sclerosis fatigue. It is only approved for adults who have specific disorders and is typically prescribed as 100 mg or 200 mg doses. Efficacy and safeness. Modafinil is demonstrated as being highly effective in promoting wakefulness, alertness, and other cognitive functioning in individuals with fatigue disorders and other neurological and psychological disorders such as ADHD, schizophrenia, and more. Despite some of its adverse side effects, which affect a low population of its users, it is generally safe and a well-tolerated stimulant. The drug's abuse potential is low due to its low addiction potential, and it lacks withdrawal syndromes. Overdose and toxicity of modafinil are rare. It is not approved for pediatric patients due to possible increase of adverse side effects and lack of study of pediatric use. Modafinil's effects on neurotransmitter systems. Modafinil affects many neurotransmitter systems, including the catecholamine, GABA, glutamate, and serotonin systems. It has been shown to affect arousal and behavioral activity partly mediated by synaptic dopamine, but in a way that differs from amphetamine. It potentiates both dopamine and norepinephrine neurotransmitters and causes elevations in extracellular norepinephrine, which is responsible for adrenergic receptor-mediated effects involving A2 and A1 receptors, which enhance the effects of cognition and behavior. Effects on GABA, glutamate, and serotonin systems. The effects of modafinil primarily takes place in the neocortex. Modafinil has consistent effects on central glutamate and GABA systems. It has been shown to increase glutamate in the thalamus, and in higher doses, it increases glutamate in the hippocampus and striatum. Its effects on GABA are partly mediated by adrenergic effects on serotonin activity. Increases in the cerebral glutamate result in enhanced glutamine synthase activity through mRNA content of enzymes being increased from modafinil. It also increases FOS immunoreactivity in cells and binds to the central neurotransmitter elements of dopamine receptors and norepinephrine transporters. Here's a little diagram of the neural effects of modafinil. As we can see, it increases norepinephrine in the thalamus, in the hypothalamus, and in the cortex and in other regions. It decreases GABA in the striatum cortex, the posterior hypothalamus, the ventral medial preoptic areas, and more. It increases dopamine in the striatum cortex, the accumbens, and it increases histamine in the cortex, the hypothalamus, and other areas. It increases orexin in the lateral hypothalamus. It increases acetylcholine in the striatum, lateral dorsal, in the basal forebrain nuclei and other areas. And it increases glutamate in the medial preoptic area, the substantia nigra, the cortex, the hippocampus, the posterior hypothalamus, the hypothalamus, and more. And it increases serotonin, or 5-HT, in the cortex, striatum, and the central nucleus of the amygdala, and more. The use patterns of modafinil. Modafinil use patterns are mainly displayed in those that are prescribed it, those generally being individuals with narcolepsy, ADHD, fatigue disorders, and others. Among recreational use, modafinil has been seen to be used by students in order to maximize learning, primarily in the United Kingdom, through unregulated pharmacy sites. However, according to a lack of research found on its recreational use, it seems that the non-medical use patterns are low, especially in comparison to the United Kingdom. So now that we've talked about modafinil, here's a little overview and summary of modafinil. Modafinil is a stimulant drug used to treat a variety of psychological disorders, but mainly narcolepsy. It increases wakefulness, attention, memory, and other cognitive abilities through affecting several neurotransmitter systems, such as the catecholamine, GABA, glutamate, and serotonin systems. Thank you for watching.